And as a follow-up, do you think the vaccine was net neutral, or that it might have had on certain populations a negative effect on heart health?
Thank you for asking the question. Uh, I'll start with the facts. So I've been practicing cardiologist in Calgary, in Canada. So if your question is, Dr. Kapoor, did you see a lot of patients after COVID coming to you from more heart disease issues are happening linked with viruses or certain patient group? I did not.
Okay.
I have not seen a huge uptake of the patient or certain category of the patients that could be potentially linked to it. Okay, so I've not seen anything
Okay.
totally explosion of heart disease, explosion of heart failure, because we have cardiac imaging centers in Alberta, two in Calgary, one in Edmonton, one is in Medicine Hat. We do so many ultrasounds a day, so many heart tests a day. We have not
Yeah.
seen the people coming in. Like we have to see to believe it, right? Because I have not
Yeah.
seen that. So secondly, yes, there was harm done to the patients. There were patients who got heart failure or myocarditis, some complication. Yes, it was done. And we could have been better. So, like any other clinical study and the trial, we always do studies to figure it out who potentially will have the side effect, what in a patient population we should advise them not to have it. But at that time, we have to go back. We were all panicked. We were all
Yeah.
afraid. I remember when I would come home, my wife will make my clothes, make me undress in the garage, and she will not make me come inside the home. So
Yeah.
you're coming from the hospital, you're coming from the clinic. I
Mhm.
don't want you in my home with the same clothes. People are afraid at that time. You can
Yeah.
imagine. So at that time, yes, if you go back those times, my argument with my clinical colleagues was that we should have an informed consent. We should
Yes.
let people be aware of it because they're taking a vaccine or a drug or a test. Doesn't matter what it is. We should inform people. And people are informed, they can take their call. Everyone is educated. They're not going to take a
Yeah.
wrong call if they understand that. But in a panic, I think that's where the biggest failure of the science was, that we panicked, we threw out the logic out there. So that's the biggest mistake happened. We should
Yeah.
have kept the consent form. We should not have been strict about these mandates, and we should have let people pick and choose, have been well informed that way, or at least we should have told them, look, guys, we don't know. We don't know a lot about COVID. We don't know much about the vaccines either,
Yeah.
but it seems like a solution. But what do you think? You want to take it, you can take it. If you don't want to take it, don't take it. But at least it's informed decision making, informed consent. They understand that. That's where the biggest mistake happened. So yes, people who got vaccination, some of them they have the side effect. So your question could be, how would I have known who will have the side effect? What we have
Yeah.
learned is, since that the biggest clinical trial happened in real time in our lifespan, millions and billions of people got exposed to these vaccines. What vaccines does it, or what any virus or any drug does it, all of us are born with the whole genome DNA we inherited
Yeah.
from our parents. All of us have some kind of mutation in our body. We just don't
Yeah.
know which mutation I have or you have unless I've downloaded my whole genome and someone has explained it. So we knew that before COVID vaccination, some people are getting heart failure, some people are getting premature heart disease. We know that. Why? Because they have a genetic condition linked with that.
Yeah.
So what COVID vaccine did, or what COVID did, like any other virus does it all the time. Normal flu virus or vaccine, or a normal any other virus that goes in our body, we take it from in a plane traveling or talking to our friends and family. And
Yeah.
what did these viruses do? They trigger the gene reaction in our body. We just don't know. And this reaction then contributes into heart failure, blood clotting potentially, strokes, brain hemorrhages, or whatever could be linked to it. Essentially, a gene is there, the mutation is there, the gene was not causing any crime, something comes in and then triggers that reaction, and now we have this disease in that person. That's what vaccine or viruses end up doing it sometimes. So not everyone got it, but some people were unlucky. And it happened, unfortunately. Yes, we could have done in a controlled manner. It happened in a panic situation. So that's where the harm
Mm.
got done in that regard.